everyone. Today we are going to learn about communicable diseases, their modes of transmission and prevention. So, what are communicable diseases? Communicable diseases are diseases that can be spread from one person to another. Communicable diseases are caused by microorganisms. Microorganisms that can cause these diseases are known as pathogens. For example, bacteria can cause cholera, whooping cough, tuberculosis, tetanus. Viruses can cause measles, chickenpox, polio, hepatitis. Fungi can cause food poisoning, ringworm, athlete's foot. Protozoa can cause amoebic dysentery, malaria, sleeping sickness. And worms can cause teniasis, elephantiasis, and ascariasis. So let us know about some communicable diseases, their causes, transmission, effects, and symptoms. Tuberculosis. It is transmitted by air. It affects our lungs, and the symptoms are coughing and chest pain. Typhoid. It is transmitted by contaminated food, water, and direct contact. It affects our stomach and intestine. The symptoms are stomach pain, loss of appetite, constipation, cough, and headache. Cholera. It is transmitted by contaminated food and water. It affects our stomach and intestine. The symptoms are vomiting, acute diarrhea, extreme thirst, muscle cramps. Botulism. It is transmitted by improperly canned food. It affects our nervous system. The symptoms are fatigue, dizziness, muscular weakness, and paralysis. Diphtheria. It is transmitted by air-droplet and use of articles of infected person. It affects our throat and upper trachea. The symptoms are sore throat, pain, fever, hoarseness, and nasal discharge. Influenza. It is transmitted by air droplets. It affects our upper respiratory tract. The symptoms are fever and body ache. Poliomyelitis. It is transmitted by food and water contaminated with infected feces and person-to-person contact. It affects our nervous system. The symptoms are irreversible paralysis in the limbs. Hepatitis. It is transmitted by contaminated food and water, blood of infected person, and needles. It affects our liver. The symptoms are jaundice, fever, nausea, headache, pain in liver, reddening of hands and feet. Chickenpox. It is transmitted by direct contact with infected person and air droplets. It affects our skin. The symptoms are onset of fever, itchy rashes with pink spots and tiny blisters. Common cold. It is transmitted by air droplets. It affects our upper respiratory system. The symptoms are watery eyes, dry throat, headache, and runny nose. Measles. It is transmitted by droplet infection through coughing, sneezing, and spitting. It affects our skin. The symptoms are sore throat, runny nose, watery eyes, dry cough with fever. Small whitish spots appear on the inner wall of the cheek, and then red rashes appear first in the neck region and then to the whole body. Ringworm. It is transmitted by direct contact. It affects our skin. The symptoms are red itchy, scaly or raised patches. Patches may develop into blisters. Let us know about transmission of communicable diseases. How these diseases can be transmitted from one person to another person. There are many ways. Number 1, through air droplet infection. The germ of some diseases are present in the windpipe, nasal passage, throat, and mouth of the infected person. A sneeze or cough from an infected person releases a mist of droplets full of microbes into the air. So when a healthy person inhales this, microbes enter their body and infect them. Examples of some diseases are cold, influenza, tuberculosis, measles, and diphtheria. Number 2, through food and water. Diseases such as typhoid, dysentery, cholera, and other intestinal infection spread through contaminated water. Such diseases are called waterborne diseases. Water may get contaminated when infected person bathe, wash, or defecate near source of water. So when contaminated water gets mixed with drinking water, it causes infection. By insects and other animal vectors. Heaps of waste and stagnant water serve as breeding ground for insects such as flies, mosquitoes, and fleas. Microbes get attached to these insects when they visit the source of infection, and when these insects sit on exposed food items or open wounds on a person's skin or bite them, they transfer the germs and thus the infection. Animals such as rats, pigs, dogs, ticks, and mice can also transfer microbes from infected person to a healthy person. These insects and animals that carry disease-causing germs are called vectors. Number 3. Through direct contact. Some infections such as conjunctivitis and scabies spread through direct contact between the healthy and an infected person. Sharing things such as drinking glass, towels, and combs used by an infected person can also spread the infection. These are called contagious diseases. Some common vector-borne diseases with their effects and symptoms. Malaria. It is caused by Plasmodium and the vector is female Anopheles mosquito. The symptoms are periodic fever with chills, red blood cell count drops. Dengue. It is caused by DNV virus. The vector is Aedes mosquito and the symptoms are high fever, hemorrhage, drop in platelet counts. Amoebic dysentery. It is caused by Entamoeba. The vector is housefly. The symptoms are abdominal pain, severe diarrhea, blood and mucus in feces. Sleeping sickness. It is caused by trypanosoma. The vector is tsetse fly and the symptoms are fever, rash, fatigue and increased sleep. Plague. It is caused by Yersinia pestis. The vector is rat flea and the symptoms are swollen painful lymph nodes in groins, neck or armpits, sudden fever and chills and headache. Prevention and control of communicable diseases. Communicable diseases can be prevented by maintaining personal and community hygiene and avoiding unhealthy habits and lifestyles, such as drink filtered or boiled water. Make sure there is no stagnant water near your house as mosquitoes breed quickly in such water. Keep food covered and do not eat exposed food items. Keep garbage bins covered. Keep personal articles used by patients separate. Use your own towel and handkerchief. Wash your hands with soap before eating and after using washroom. Cover your nose and mouth with a tissue paper or handkerchief when you sneeze or cough. Drink pasteurized milk or boil it thoroughly before drinking. Avoid direct contact with a patient suffering from highly contagious diseases such as chickenpox or measles. Let us know about some ways to prevent food poisoning. Some ways to prevent food poisoning are: rinse vegetable and fruit in running water before consumption. Cook food properly, especially meat, to kill germs. Do not leave food uncovered and outside the refrigerator for more than 2 hours in summer. Leftover food should be kept in refrigerator immediately. Do not consume food items from roadside vendors. Keep bags containing meat, fish and poultry products away from the vegetarian items to prevent contamination, and do not eat stale food. So this was all about communicable diseases, their modes of transmission and prevention. Thank you.